Katie actually was born with a completely normal heart, and when she was about 3 weeks old, she was diagnosed with idiopathic cardiomyopathy, which basically just means disease of the heart muscle.
We noticed that she was breathing hard, and her breathing became more labored, and her color wasn't good, and ultimately we just took her down to the pediatrician, and the pediatrician took one look at her and said, get down to children's right away. She's just in really bad shape.
It was about a 5-week waiting period by the time we decided to move forward with the transplant and the time she actually received the organ.
The transplant is not a cure. You're in effect trading a terminal disease for a manageable disease. The immunosuppressants are in effect creating an immune suppressant disease, in effect, that you have to watch. And that has caused issues. It's caused issues with her kidney. It's caused issues with her diabetes, and that's just stuff we're going to have to work with.
Kyle was born by cesarean section, actually, uneventful pregnancy. Thought everything was fine, and then about an hour after birth, we realized that he had some major heart problems, and that started a event that's been ongoing now for 16 years. He had his first surgery when he was about 5 days old. At 2, he went in for the second stage of what we thought was a 3-stage repair surgery, the Fontan. When he was 6, went in for what we thought would be the final heart surgery for him. And things didn't go very well. We had some counseling, and Kyle finally came around to the realization that he needed the transplant. So he agreed to it, and we went through the process and got on the list. You're sitting there waiting on a phone call, waiting for a heart, when you know for you to get a heart that someone else has to lose a child. And that's difficult to reconcile. Sitting there, you don't want to pray that someone dies so you can get the heart, but realistically, you realize that that's what has to happen so your child can grow and have a somewhat normal life. We finally got the call. The phone rang, and it was the transplant coordinator. She said, get Kyle ready, bring him on to the hospital. We think this is it. Went through the surgery. It lasted all night, and the next day about noon, we were able to go back to ICU to see Kyle. And his cardiologist walked out, and he said, Kyle's awake. Kyle's communicating with us. Compared to previous surgeries, the nurses told us, Kyle for the first time has a totally healthy, functioning heart.
We didn't have a choice in the situation. We did. We had 2 decisions, or 2 choices. One was to not move forward with the transplant and we would lose her, or at least give her a second chance at life. So, to us it was easy. And you move forward and, I guess, take it as it comes, day by day. That's all you can do.